Dear patients and friends, in the last video, we saw how the integrative medical approach works and discussed on the idea that the trigger points don't start in the muscle. They start in the spinal cord. But that raises a more important question. If the problem is in the nervous system, why does adjusting the spine help at all? Most people think chiropractic works by putting bones back in place. That explanation is simple, but it is not accurate, because bones don't randomly go out of place. The nervous system puts them there. Every joint in your spine is filled with plenty of sensory receptors. When a joint stops moving properly, then those receptors stop sending normal information to the spinal cord. The brain doesn't see structure, it sees signals, and when the signal changes, the entire segment changes. The muscle tone increases, the pain appears, and the movement becomes restricted. A precise chiropractic adjustment is not just mechanical, it is neurological. It delivers a sudden, specific input into the nervous system, a burst of information, and that input can interrupt the abnormal reflex loop. For a moment, the system resets. However, it is just for a moment. And exactly here is hiding the problem, because if the underlying reflex circuit is still irritated, the system will return to the same pattern. That is why adjustments often feel good, but don't always last. This is where an integrative approach becomes essential, because the joint is only one part of the segment. The same spinal level also receives input from muscles, fascia, ligaments, periosteum, even internal organs. If any of these continue to send abnormal signals, the spinal cord will rebuild the dysfunction. In our method, chiropractic is not used alone. It is used at the right moment, after reducing pathological input from the segment, after calming the reflex loop, after releasing deep contracture. Then the adjustment becomes stable, because the nervous system no longer needs to protect. When used correctly, chiropractic care does something very specific. It restores the quality of information entering the nervous system, not by forcing structure, but by influencing control. And that is a completely different model of treatment. The spine is not just a structure, it is an interface. And when you treat it as part of a system, not in isolation, results change completely. In the next video, I'll show you why treating the periosteum can be the missing key in chronic pain.